as autosomal recessive. The only element that can evaluate for the cause is the parent, that you are going to do a gene typing in the parents. Is it clear? So the gene typing you need to know that generally when you want to do a gene test, you have three main tests. You have karyotyping, is it clear? You have FISH, and you have the array chromatography. Is it clear? So those are the three major, the computed array displacement. Those are the three main tests that you have to do. So you choose one of the tests, particularly the FISH, to find if the patient has the different genes. So for the genes, generally is not needed, because here the eligible electrophoresis can help you to assess either is the gene typing, or you still assess the parents with the HB electrophoresis. Is it clear? Now the next one is the complication. So we have all the different arrays of complication that we have said, and we have not to forget about the precipitating factor. So in the course, since it is an autosomal recessive condition, what we are going to evaluate are the precipitating factors at the level of the cause. For the precipitating factor, we said for hypoxia, if the patient is hypoxemic, you have to give oxygen to the patient. If the patient is dehydrated, you have to give fluid to the patient. Is it clear? Every time a patient with sickle cell is dehydrated, give fluids, and there is a protocol for fluids management to give fluids in a patient that is sickle cell. So you have to give fluids in the patient, but all that is going to be visualized in the management. So for the hypoxemia, to evaluate for that, for the hypoxemia, you just ask for the saturation to support, and to confirm you ask for the arterial blood gases. For the dehydration to support, you can just ask for the urinalysis, where you are going to have the specific gravity is going to be increased, and the hematocrit also is going to be increased, and then to confirm you have the urea creatinine ratio that is going to be greater than 20. Basically, to know if a patient is dehydrated. Now the other elements now, so that is for the occlusion. So hyperthermia, you just need to measure the temperature of the patient to find if the precipitating factor is hyperthermia. To find if the precipitating factor is hypothermia, you still need to measure the temperature of the patient. Hypothermia. So those are the different precipitating factors that you have to assess. Is it clear? And don't forget that under those precipitating factors, there were etiologies. Is it clear? For the hypoxemia, we said that we can have an acute pneumonia. So if you have a patient that has acute pneumonia, you have to also evaluate for the acute pneumonia. Is it clear? COPD, asthmatic crisis, you have the different investigation that you have to do for that. We are not going to do that here. Now the next one are the complications that you have to investigate. So in the complications, what are the things that you should investigate in the complication? The first thing in the complication, you need to investigate for acute complication for the vaso-occlusive crisis. Vaso-occlusive crisis, sequestration crisis are clinical. There is, apart that, you can use ultrasound in order to visualize the size of the spleen in the sequestration crisis. In a vaso-occlusive crisis, you can still use a Doppler ultrasound to know the perfusion rate of the limbs. Is it clear? To find the pressure and all that. But those are additional tests. The diagnosis is made clinical. For the aplastic anemia, you have a full blood count that is going to show you a pancytopenia. And when you do, the next thing you do is to ask for, every time you have an abnormality on the full blood count, the next thing is to ask for the blood smear. Is it clear? To know the different white blood cells, the red blood cell count, and how they are. Is it clear? And after asking for the blood smear, you now ask for a bone marrow biopsy and histopathology. So the blood smear is going to show you that there is no compensatory reticulocytosis. Is it clear? And for the bone marrow biopsy, you are going to visualize that there is going to be fibrosis inside the bone marrow. That's going to tell you aplastic anemia. Is it clear? So those are the different things that you have to note here. Now for the next complication you have to evaluate is going to be hemolytic crisis. For hemolytic crisis, to find for the signs of hemolysis. Is it clear? What are the elements that show you that somebody is hemolyzing? So for the red blood cells, you need to know that the red blood cells are going to be chimalform, called schistocytes. Is it clear? There are going to be schistocyte red blood cells. You have also teardrop red blood cells. Is it clear? All that can tell you that there is hemolysis. You have teardrop red blood cells, or you have schistocytes, malformed red blood cells, that can tell you that there is hemolysis. Another element that can tell you that there is hemolysis, you're going to have increased level of certain enzymes that are normally present in the red blood cells, like the lactate dehydrogenase. Is it clear? Or you have the G6PD. Is it clear? The G6PD is going to be elevated in blood. Is it clear? Now the next one after that, so you have mostly particularly lactate dehydrogenase. The next one after that, now you have a patient that has also serum iron. The serum iron profile is going to increase. That is, the transferrin level is going to be increased. The serum iron is going to be increased. Is it clear? Can tell you that the patient is hemolyzing. Is it clear? So those are the major elements. And you have also the haptoglobin hemoglobin level is also going to increase in blood. Is it clear? The haptoglobin hemoglobin level is going to increase in blood. Is it clear? So all those are the elements that can tell you that the patient is actually hemolyzing. Is it clear? So after that, now you have the chronic complication. I'm not going to speak about chronic complication because we are going to see that in the specific topics of the patients. Is it clear? And then the next one is the background, and then you have the treatment that you have to work on.